Today I am joined by Elliot Kaminetzky, and I'm really happy to have the chance to talk with you. We have had the opportunity to see each other a couple times in the last month or so, and it's been great to hear some of your perspectives. And I just wanted to have a conversation about how you got involved in all of this and where you think things are going and what is all of this even.
Yeah.
So, Elliot, you're a psychologist and you've been engaging in some of the gender discussions that have been going on. And I don't know, I'm just really interested. What's your background and how did you begin exploring these topics?
Sure. Sometimes I wish that I had like a more comprehensive journal during the COVID years, a little bit beforehand, to know exactly what I learned when and how my thinking evolved on it. But I think what was influential was this kind of habit I have of always trying to listen to both sides of every issue and seeing where they agree and, the parts that they disagree, what's underlying that. And I did that with news, and I did it with, psychology, everything else. And so I would listen to like liberal side and conservative side for issues. And I think as it came to the gender related question, it was something like, something spoken about more on the conservative side and not spoken about so much on the other side is what I found. Or like almost like they would speak about it, but there was like very little point of very little overlap in the conversation. Whereas one side was like saying like, they are they're harming all these children, it's terrible, and the other side saying they're saving the lives of all these children, it's amazing, and all of them are terrible. So like I haven't seen a lot of issues that had such polarity. Like there are a few, but I think this one is particularly polarized to the point like that we're not having discussions about it with people who are very important to have discussions with, like the people who are healthcare professionals. Like I find more and more that the conversations are getting shut down and devolving into ad hominem attacks and trying to really question the motives of people who are asking questions. But I think as someone who always likes to ask questions, I'm not going to make an exception for something that has to do with child mental health, child physical health, something that's so important, within healthcare. So I think as I continued asking questions, like I found like there was a split as well in terms of like individuals who are giving you a lot of fluff and in like kind of just very philosophical, very sociological in nature about I don't know, it just didn't sound scientific, like the same way we discuss any other treatments. And then individuals on the other side, we're giving much more in-depth, nuanced conversations, like people at SEGM, Society for Evidence-Based Gender Medicine, GenSpect. Like I think you were seeing more data. You were seeing more systematic reviews. You were looking not just at one country, the country that you're in, but I know Americans like to do that, but realize like there's a whole world outside and kind of understanding how it's being understood differently. And I think my sensitivity in that grew, and I was kind of hit with a tremendous quandary and challenge, which is like, what do I do with what I know? Because I do know that I'm not allowed to talk about it, right? But that didn't sit well with me because, I don't like needing to be quiet about this. So I started by just talking to my colleagues one by one. And these were people who were very liberal. They had their pride flag on their social media profile. I figure like, and they're brilliant people, like authors and tenured professors and, you know, really brilliant people. And I wanted almost to be reassured that what I know isn't true. Like what I know about the concerns related to this branch of healthcare isn't true, such as, the lack of evidence base behind, puberty blockers. Like I wanted to hear how like it's, really there is a tremendous amount of evidence, but they all like one by one were like, yeah, it's pretty messed up. It's really a problem. The research is really not there. But it's something that I really can talk about. I can't let other people know because it's such a politically charged issue. And that was always like a little bit of a downer. Whereas I thought like, okay, let's get this conversation going. And they would say like we should definitely be in touch, and then they got very busy with all their other articles or all of their other commitments, and this didn't rise to the top, which is unfortunate. But I think I became increasingly frustrated when everyone would agree with me, but would say like, more power to you. Thank you for bringing up this conversation. It's so important, and also, best of luck. So, one colleague actually brought it up to his local therapist group, right? So that was actually kind of nice that while I did get a lot of support and confirmation about what I did believe, it was also kind of scary that there's what professionals believe and what professionals are, being like said to believe or understood to believe. This idea like there's this total consensus of all the doctors and medical organizations. So if you have like the American Psychological Association or the Association of Behavioral and Cognitive Therapies, and they say like, oh, they're all in agreement, when all of the members don't agree, like, is that really consensus? So then I started speaking out about it myself. I tweeted about it, and I was surprised that I wasn't getting a lot of pushback. I was told because I'm relatively unknown, so so maybe it's good to be not so well known. But I talked about it. I was getting a lot of positive feedback for being so brave to speak about it, and I brought it up in the largest Facebook group for psychologists or people in private practice, and it was deleted, and I'm currently blocked from there. It was brought up in my local OCD group, and they did facilitate the conversation. And a lot of people would just say things like, I'm glad you brought this up, looking forward to the discussion. But it wasn't really, and a lot of, there were some people who did bring up objections to the concerns that I raised. And these people like touted themselves as experts, but like what they were saying was like very misguided. So for example, someone would say like, yes, while you're concerned about puberty blockers for, trans-identified or gender dysphoric kids, they also give it to, kids with precocious puberty, right? So it's like, okay, that makes sense, right? Like you could take that on face value, right? But if you know a little bit more, that's kind of very misleading, because precocious puberty kids will take it, they'll stop it, and then they will have a natural puberty and move on. Whereas at that point at which kids with precocious puberty would stop it, people with kids with gender dysphoria will start it, and then will almost inevitably go into cross-sex hormones. So you're bringing almost a totally irrelevant point, and I don't even think she knew that. I think so that's why I'm going to continue speaking up about it and having these conversations. And I think we're at a point where it's welcomed, and less chilled.
Mhm. Well, it's really an interesting phenomenon to be among professionals who will privately agree with you, but publicly refuse to, and keep representing something that they know, and that they know to be false, at least by omission, by failing to engage in the conversation. And there's
Yeah.
something really strange about that self-censorship and how it allows something like this to continue to perpetuate.
Yeah, I totally agree.
When did
And
you first start to notice that this was kind of an untouchable issue?
I think I always kind of knew that it was untouchable. I mean, like you would like see the news about maybe like trans activists
Mhm.
and people being injured for bringing it up, and you would
Mhm.
see people being harassed and doxxed and going after people's professional license. So like I would listen to a lot of podcasts, and I would watch the news, and I was on social media, and I would see the treatment of people who would bring it up.
Mhm.
And some from a more from a feminist perspective, some from a medical perspective. Like it's a very wide-ranging sociological issue.
Mhm.
So I think I would see how they're treated, and I realized like, hey,
Mhm.
this is like verboten.
Mhm. I remember when I was in graduate school, when I started graduate school in 2019,
Hmm.
I was in a human development class,
Hmm.
or I guess it was lifespan psychological development. And we first, this was the first time I heard about the trans child. And it
Mm.
was in another student's presentation, but there was this way that it was welcomed and embraced and kind of celebrated by the professor and the other students that I felt kind of uneasy about it, but I didn't feel like I could speak up. I didn't feel like I could voice what was making me uneasy. And so I kind of just
Yeah.
let that lie. And that was a really weird moment. And then a year or so later, when I was studying human sexuality in the same graduate program, they had us watch, or our professor had us watch a documentary. And it was about how trans people have always existed, and very specifically about the trans child. And
Mm.
I thought this was really interesting because this seemed to me to be like, it felt like this moment where I'm thinking, did I miss something? Like, did I miss something? Was there a cultural conversation that was happening where we discovered this? Because this is a very different way of talking about these things than I remember. And so
Mm.
I was left with this kind of like looking around for confirmation. Like, can you tell me the piece that I'm missing, but not feeling confident enough to say, no, I think
Right.
you're doing something wrong here. But it feels
Uh,
like there was this accelerated cultural jump where we just suddenly started thinking about gender in a new way. And did you kind of have that sense as well? And was that after you were already completed with your training, and were you already working in the field when this started to happen,
I
or
think
what was
like
that?
I think like maybe 2016,
Okay.
2017 was around when it started like that sharp increase.
Mm-hmm.
And you know, myself and so many people in my training would say like, in the course of my whole training, so imagine 2011 till let's say in the clinic 2015, 2016, they didn't come across one child who had gender dysphoria or trans identified or gender questioning. And now like the same colleagues are saying like, oh, like half my practice is, kids identifying as trans. So I think yeah, like that's pretty astounding to have like
Mm-hmm.
such a shift. Um yeah. So like when that happened, like I don't know, maybe it came along with Trump. Like I feel like he stirred the pot, and all the, like there was a lot of exacerbations of like people's I don't know, priors, whatever
Hmm.
it is. Like, I feel like it kind of made the country crazy.
That's
And
interesting.
COVID certainly didn't help either.
Like an accelerant.
Yeah,
Hmm.
it was
Hmm.
like he was like a living fuel of all
Hmm.
fires,
Hmm.
you know.
Hmm.
So I think including, I think this came along with that, like around
Hmm.
that time.
Hmm.
Like I think he brought out the activists in people,
Hmm.
and he brought out the the politics in people, because suddenly people who were very, detached from politics, you have a celebrity in office. So it's
Hmm.
like everyone gets into politics, right? And I
Hmm.
don't know if everyone should be into politics, right? And have such strong opinions. And I think like everyone dug their heels so deeply. And I think when you have politics and science, they're not always the best bedfellows.
Hmm.
So I think, like, I don't know if there's been research on this, but like, I do think there's some connection
Hmm.
between like that era of time when things got kind of wonky.
Well, it does seem like it sort of marks a point at which people were more comfortable, I guess, expressing that polarization. And that
Yeah.
polarization itself is kind of the process that has been taken to a lot of different areas. You got it in gender, you've got it with race, all kinds of
Yeah.
COVID was hugely polarizing.
Yeah. And I think maybe for the first time, you would have the sentiment that having conversations themselves meant you were colluding with evil, right? Like even engaging with any maybe centering opinions,
Hmm.
like that was itself evil. And maybe when like two sides can't have conversations anymore, like you get so detached from reality,
Hmm.
because like there's no middle ground. So this idea, like when you're hearing two sides of everything, like the part they agree on is usually the facts,
Hmm.
right? Like if like, and then there's the interpretations and the sequelae of each of them,
Hmm.
and that's maybe where they differ. But now like we can't even agree on like facts, and I think
Hmm.
that gets very dangerous because facts matter, and especially when it comes to healthcare, they really matter.
Hmm. Yeah, I think that's a really good point about the two sides can't even talk to each other. And that's where we get cancel culture. And
Hmm.
I I was shocked when I was told, and I've talked about it a lot, so people have probably heard me say this before, but when I was told in my master's program that the faculty and the administration were aware they were not training counselors who were going to be able to work with the Trump supporter. This is what she said: the Trump supporter. We can't work with them. We
Right.
and it seems like such a shocking blind spot for people who are teaching applied psychology to say
Yeah.
we can't even talk to you if you think in a way we don't like.
Yeah. I think that's so dark. And I was very inspired by your story in terms of like coming out myself,
Mm-hmm.
how you really spoke out, and didn't take the garbage from your program. I
Mm-hmm.
thought that was very inspiring for me, by the way. And
Thanks. That's nice.
um, yeah, I think Atul Gawande, who's like a wonderful author about medicine, talks about like the foundation of, he spoke about a story where like this drunk, racist, awful, screaming at all the nurses and being terrible, came into the ER, was like the exact person you would never ever want to ever see in your whole life. And uh, he said, like, what does it mean to be a doctor? Is that like you care for them regardless? Like you are the person who's going to totally disregard all of the crap and see a human being
Mm-hmm.
who's suffering behind it,
Mm-hmm.
and using your skills to help that person. And I think like I don't think mental health is any exception. Like I think if anything, like we understand why people act the way they do and believe what they do and emote the way they do. So if anything, we should be the most understanding and compassionate people. So it's like so backwards.
Mhm. Yeah, absolutely. I think that's really well said. And I think that it kind of gets back to the question of why people right now are so afraid to talk about some of these things. And there's understandable reasons why they would, not that it's good that they won't. It's we would all this is one of the things that not necessarily on the professional level in terms of this field, but just in DEI trainings, I end up talking with people who are not sure if how to navigate this. I want to speak up. I want to say this sounds wrong, but I also want to keep my job and I need to make a living and I don't want to upset my friend group. I feel like I'll be an outcast if I start talking about this because everybody's so strongly for these kind of social justice concepts in this particular way. And there's a there's a degree to which I think we want people to shrug this stuff off and start speaking frankly and openly about it, because that will help to reduce the mystique that it has and the power that it has. If everybody who feels this is wrong will just say this is wrong.
Yeah.
But you have to understand that each individual is making their own choices that make sense for their lives, and have some compassion for the fact that it's difficult for people to overcome those things. And I think that for me, if I had been on the internet more, if I'd been in social media circles more during the time when I was in school, I might have been too intimidated by hearing all of the other people, all of these opinions, and by fearing reputational damage. If I
Yeah.
felt like I had any reputation to
Yeah. Right.
uphold. And it was kind of, the internet was this, so there, I guess I'm kind of wondering, what are your thoughts around all these social pressures and how they interact to keep us kind of censoring ourselves and flattening ourselves to some degree?
Yeah. Great question. So it brought up a few ideas. One is like when I started speaking up about it in various forums, um, a lot of people would thank me for saying something and would say like, I don't feel comfortable. Like, I hope you're not judging me
Mm,
that I'm not willing to speak out. And I
yeah.
said, like, hello, I didn't speak out for 38 years, my whole life, right? And suddenly I say something,
Yeah.
I'm not gonna judge you at all for not.
Right.
But I could tell you part of my own process that helped me speak up. And I think for me, and I actually am doing a series about people who speak up about things or who use their free speech. And I resonated with this idea of like when you feel that you are self-censoring
Hmm.
and you are just going along with something, like it felt very deflating,
Hmm.
depressing. Uh, you feel like powerless, and it was like I wasn't able to, it was like hurting my sleep at night, and I would just like distract myself,
Hmm.
maybe by listening to like more and more podcasts about it, right? But I felt like so so I felt terrible.
Hmm.
So I think some people might have more sensitivity to that.
Hmm.
And so, but ever since being able to say the truth as I see it to, you know, to really anyone,
Hmm.
like I don't think my life has ever been better.
Hmm.
So like, at least see that there's a carrot at the end. Like if you're struggling to say what's on your mind, and like it is the most freeing thing ever.
Hmm.
So um and also I think there's this concept of um it's this Latin phrase like fiat justitia, something something like let do the right thing, and whatever happens happens, or do it's a let justice be served though the sky may fall.
Hmm.
Like you don't necessarily need to worry about the consequences per se of doing the right thing.
Hmm.
Like you should focus mostly on doing what you know to be right, and not saying that that's not an easy process, and it's important to question yourself. But I think like you shouldn't calculate so carefully the consequences of doing something that you've established and known to be right. And as Jordan Peterson says, whatever outcome comes of telling the truth or being honest is the best possible outcome. And I
Mm.
think that's like a really powerful way to live.
Mm. Those are really good examples of your own process. And the first one, when you're talking about this restlessness and this uneasiness versus the clarity that you have now in communication, it sounds like what I picture when you're saying that is the conflict was internal and you externalize the conflict. So the internal process, you're not having to deal with that inside of yourself anymore. You're not wrestling with your own conscience.
Yeah, absolutely. And I think you made an interesting point about friends. Um, I think when you're honest, it really provides you with like a helpful filter system between those who actually love you and care about you and those who love this like version of yourself that isn't you.
Mm-hmm.
So like when you kind of come in touch with who you are and express yourself for that, it's kind of helpful
Mm-hmm.
to like not have people in your life who don't actually like you,
Mm-hmm.
right? So even if someone's friends with you, if it's not your real self, they're actually not your friend already,
Mm-hmm.
right? Even though you may be spending time with them. But I think it's kind of a helpful thing uh, to spend time with those people who are actually your friend.
How has that been for you since you've been more open? Have you felt like your relationships have benefited from that or have suffered from that?
I never had friends. No, I'm kidding. Uh, so, I mean, luckily, I would say for the most part, I've kept all my friends. I think like maybe as like an Orthodox Jew, I live in more of a heterodox, which is kind of ironic, like a more heterodox world where like people will. I just get that there's a lot more tolerance,
Mm.
which is kind of funny for like different opinions about things. Like maybe there'll be people who will be conservative about one thing and very liberal about others.
Mhm.
And I've always existed in this world with modern orthodoxy where you have like, let's say orthodoxy and like secularism, and
Mm.
you're kind of straddling this line. So I think I kind of like always existed in that space
Mm.
where things aren't so clear and things are in life inherently complicated. So I think it was kind of natural to me, and I was surrounded by people who were able to wade through the complexities of life. And also, I feel like Jews also uh, there's like this culture of argument, and there's
Mm.
almost like you could see the beauty that comes from people disagreeing. Like we have the Talmud, like Jewish law, and it's basically like 27 books, like huge books of just arguments that you kind of wade through. So
Mm.
I think like being able to appreciate, the being part of a group who could appreciate other people's opinions was very helpful, and I didn't lose many friends. I was blocked by two colleagues,
Mm.
which I don't like.
Mm.
Like the person who I pointed out their misinformation about the puberty blockers,
Um,
ironically blocked me.
oh, there is some irony there.
Yeah, and then this individual wrote me like this really respectful letter after I was open in my group about my concerns, and someone who's like demonstrated such willingness to engage, and
Mm-hmm.
who from the other side, I'm like, awesome, finally, like a W path expert wants to talk to me.
Mm.
And then I scheduled a time, we agreed,
Mm-hmm.
and the day before, um, she said, "There's no point in talking."
Mm.
I don't know what happened, and then canceled the appointment and blocked me.
Mm.
And I was like,
Mm.
it still feels gross. Like
Mm.
you question whether or not you're a creep, like, because like blocking you associate with like stalkers, right?
Yeah.
So
Yeah.
like for someone who's so, averse to you that needs to block you, like you question yourself, and I think it's fine to question yourself, but it still felt not great. And one of
Yeah.
the topics I cared about.
Mhm.
Hopefully one day we'll be able to mend ties, but if you're watching, please forgive me for for
Oh,
being honest.
I think that's really nice that you point that out about questioning yourself. I think it's really healthy. It's a healthy part of the process of examining, am I wrong? Before you decide I'm wrong. There's this smug, righteousness that defies that kind of self-questioning. And I think that that's where you're running into blind spots, is if you're just too quick to know that you're right. But,
Yeah,
questioning yourself as a part of that is, I think it's really, I think it's a very healthy thing.
I'm with you.
And so, what do you see, if we were to kind of get concrete about the gender issue, what's going on right now with treatment? What do you see as specifically wrong, and how should it be rectified? How should these perspectives be changed in order to come online with something that's healthier for people who are dealing with gender dysphoria?
Um, okay, that's a great question. What I will say is that number one, professionals need to um, be able to speak about it, and I think
Mhm.
they need to be protected. Sorry, my nanny just asked a question. Today. Yeah.
So professional debate and the ability for professionals to have productive discussion that is not, there's nothing taboo. We can actually discuss pros and cons of
Yeah.
different treatments.
So that's the first thing, is that
Mhm.
uh, I made a post about how I was told by this doctor that he's really concerned about everything but can't say anything. I'll be fired in a second. So I think it'd be great if there was some sort of like legal protection
Mm,
for medical professionals to opine about medicine and not be able to be fired. I think that would be
mm,
really helpful.
mhm,
Um, so that's number one. Number two, I think we need to be evidence-based in our practices. So, I think it's important to follow the international consensus that came before us. Like if we haven't yet, as in the United States, conducted our systematic review, like you would think we would at least rely on the number of countries that already did and came with a very similar conclusion. So I think recapturing this area of medicine and mental health from activists to scientists, I think will be, scientists from regardless of where you're coming from, but it has to be based in science and research and meaningful research, such as like mental health outcomes, long-term mental health outcomes, and without any kind of censorship that um, that tends to get in the way of it.
mhm. Where do you see accountability lying most in this? If we can look at this as a health scandal, or I mean policy scandal, what is who's most accountable? Is this a psychological issue? Is this a issue of medical ethics?
That's a really good question. I think there are certain actors who have acted particularly egregiously
Mm,
in the realm of research. And I won't name names, but like, for example, um, if you're doing research and, it's best practices to pre-register the measures you're going to report on.
mm,
And if you collected data on anxiety and depression measures pre and post, but you didn't report on them, like
mm,
in a study about the impacts of a particular gender affirming care, I think that is very unethical and very dangerous, right? Like, why is that information being omitted? So I think researchers who don't do like a very basic due diligence that any kind of intro to psychology student would be able to like point out major flaws. And like, for example, in the Dutch protocol, like when they discuss like the switching the scales, such that it was no longer relevant in the post scale, which kind of like, I don't understand how that couldn't have been obvious to them within that Dutch protocol. So I think like that is concerning, because I think that really introduced a whole new factor that medicalized much younger at a point where people have the most underdeveloped frontal cortex. And so, so I think like shoddy research practices, because things come from the research. I think journalists hold part of the blame for, and I think they've since tried to compensate and do better coverage. But, there's so much like misreporting about studies, right? Like you'll have a science reporter report on a particular study and totally like not understand the findings, not contextualize the findings. And I think also like editors of journals and news outlets who will really be will really gatekeep the
make sure it's presented in just one way.
Yeah, or we'll say we're not taking articles about this.
Yeah.
Like there are people who've been trying to get, journalists who I know who've been trying to get important stories out there. But they'll be like, sorry, we need to cover, I don't know, something else. So I think like, when you have a situation like this that's so wide ranging, the blame is gonna be everywhere. And I think the blame also is in, and while I still understand why people don't say anything, I think, if you are in a position of power within a particular organization and know that something's wrong, I think not saying anything is a problem, even though I understand why not. Like, I think it was a problem when I spent years not saying anything. Like, why did I wait until now? So like, I guess I'm also to blame, right? So there's a lot, there's a lot of blame to go around, but I think, I try to focus on, we got to this point. How do we kind of bring integrity back to this field? How do we help the parents? How do we help these kids? And we could figure out blame later, but like, I think we need to bring honesty to this field like ASAP.
Yeah, it seems like a real there's a lot of falling through the cracks that can happen when you have the surgical side of this saying, bring us letters from mental health professionals, and then mental health professionals saying, we will write letters for anyone, you just have to self-report. And so both sides are acting like the other side is supposed to be doing some kind of validation of this, that this is the right treatment for this person. And both sides are looking the other way. Meanwhile, the person is just opting into something that is really life-changing and often regretted. So
yeah, it
seems like a lot of
over the
accountability.
Counter.
Yeah.
It's like OTC, like over the counter medications, where you yourself are making that decision. And it's a big one, right? Like I remember like a lot of my colleagues at Furkhoff, there was the Parnas clinic, and they were trained on how to do like these very detailed assessments on getting a laparoscopic surgery, like where they
Mhm.
tighten your stomach for as a weight loss.
Okay.
And that was like a very intense, you know, to make sure like they're in the right mindset to get this
Yeah.
laparoscopic surgery, stomach bands.
Mm-hmm.
And they would do mental health and education, and it was like a big deal. And this was
Yeah.
for something that was, like, yes, like it's great they did that, but like how much more
Yeah.
so when we're
Yeah.
dealing with kids and who very often have a lot of mental health comorbidities, physical
Mm-hmm.
health comorbidities,
Mm-hmm.
for them not to get,
Mm-hmm.
for therapists to openly, you know, be open about the fact that they will give a letter without
Mm-hmm.
asking any questions. Like I think that is really it's a real problem.
It's a glaring, it stands out as it's a different standard of care. And I can remember as a young mom, I knew another, a woman who was a couple years older than me. I would have been in my early 20s. She was probably in her early 30s, and she had one child, and she wanted her tubes tied. She wanted to have permanent sterilization. And
Mhm.
her surgeon, her doctor refused because she was too young and she only had one child. And he said, it just wouldn't be ethical. You have plenty of time to change your mind. Just because you want this now doesn't mean you'll want this later. And there were reasons. He was able to say, no, I don't think. And she probably could have shopped around and found another opinion maybe, but just thinking back on that, and now we have teenagers who are able to make these decisions that they will never breastfeed. They will
Mhm.
never breastfeed. They will take hormones that will prevent them from ever becoming a parent. And the fact that we could apply that standard at that time in that situation, but not in this situation, is really pretty shocking to me.
Yeah, Corinna Cohn
Mhm.
put it so well. Uh, Corinna said that at 25 years old, I think Corinna never thought previously that Corinna wanted to have a child, and then said that there's something happened at 25 when
Mhm. Mhm.
held a baby, and the
Mhm.
baby looked in to the eyes,
Mhm.
and that
It changed
something,
something.
yeah, like something went online,
Yeah.
right? And that's
Yeah.
at 25, right? So
And
it's like
yeah, to think that a kid who is not developmentally ready or psychologically or physically or in any way ready to think about having children could have any idea what they're giving up
yeah,
is
it
it defies just basic common sense. It's not even professional understanding. It's just basic understanding. The kid is not ready to know that.
yeah, I totally agree. I think you can't consent, like this idea of informed consent like assumes that there's like an understanding of
Mhm.
what you're giving up. And like when you talk about, when Marcy Bowers, president of WPATH, said that all of her patients who were given puberty blockers at 10 or stage 2 will never experience an orgasm.
Yeah.
Like what was informed consent look like for a
Right.
kid who doesn't
Who
know what the
doesn't know
word,
what that is? Yeah.
that's something that is a very important part of human relationships that,
Right.
that is not there.
Yeah.
And yeah, so
Yeah.
it's disturbing. It really
There's
is.
the idea of the mature minor, which is
Hmm.
oxymoronic. It just is.
Right.
It's not an insult that you're not mature. You're just not yet. You can't be a minor and be mature.
Yeah, and I think we recognize that in so many ways. I
Hmm.
think most of us adults like look at all the permutations that they've gone through in their life, and figuring, like, I went by a different name at a certain point. Like I was called myself Dylan,
Oh, but
right? For that,
Elliot's
like
such a good
toddler.
name.
I know, and it's a great name, but I let it go. There was a point where I was very, very religious,
Uh-huh.
and I decided it wasn't for me. There was
Yeah.
a time where
Mhm.
I went through so many different identities, and I think that's really what adolescence is about. Even young adulthood,
Mhm.
life is about really all of life. You evolve over life, and the idea of for an adolescent to make a permanent decision that really forecloses identity exploration
Mm.
seems like, obviously a mistake,
Yeah.
right? And especially now where they're saying like, you don't need gender dysphoria
Mhm.
in order to even have, to be trans identified and to get all these medical procedures. We're not talking about someone who's in deep, desperate pain,
Mhm.
right? Because they're saying that's not even necessary. So like for someone who's not suffering, to say like, we're going to let them have we're going to like prescribe
Mhm.
irreversible medications to undergo irreversible surgeries, like
Mhm.
seems very, all this seems so like obviously, bizarre.
Yeah. Elective body
That that you're
modification for
yeah, you're
young
kind of
people.
like, hello, like what, like, we're sensible people, like
Mhm.
what's going on? And it's so confusing.
Mhm.
And it's not like they have great answers. Like I wanted great answers.
Yeah.
This is why it's important for like, you know, um, for a non-binary teenager whose parents recently went through a divorce and needs immediately a double mastectomy, why this is important, very important to happen, and that there's a lot of research supporting, the the well-being of that person.
Mhm. Make it make
Like
sense.
that's what I wanted to hear. Like make
Yeah.
it make sense, but no one had those answers.
Yeah. Yeah.
And usually the answers were, if you question this, you hate them. You hate
Yeah. Which doesn't make
like
sense.
I decided I would make my life about child mental health. I have
Yeah.
my own children. I really care about kids and I care about people. So this idea that, I'm
That
this
you're
hate,
motivated by hate. Yeah.
yeah, like I think all kids deserve the highest quality of care. And in Western medicine is a miracle. The things that we could do, and the miracle happened because of the scientific method and because of research and peer review and these institutions. And to throw that away,
Mhm.
I think is a real disservice to, to kids, and to anyone who this is not helping.
Are you optimistic about where we are now and what comes next?
Yeah, I'm a serial optimist, so I have to always keep my optimism in check. But I think from the feedback that I've gotten thus far, um, like I think like we're ready as a society to have these conversations. I think the fact that the American Academy of Pediatrics is willing to have undergo a peer review, it seems like it's going in that direction. But I think for me, um, like I kind of focus on not necessarily the outcome as much as like what do I need to do, like what's the right thing to do today, um, to influence a future situation where everyone gets we have a better understanding of best practices. So I just focus on the process more than the outcome, but I tend to be pretty optimistic. And I'm guided by having three kids who are now like a boy and two girls, oldest 7. Like I want them to grow up into a society that will let them, be gender nonconforming without being asked whether they're the opposite gender. Like
Mhm.
I don't want them being taught, in school that you get to pick your gender. Like, and all these ideologies that really is very confusing, and it's kind of religious in nature, and it's not my religion. And I feel like I'm responsible to shape the world they're going to grow up into. And, they're going to likely experience psychological distress and medical issues, and I want the care that they get to be amazing and based in research. So I feel like what I do now is going to impact them in the future. So I feel like I focus on the now and doing what I think is right. And I'm optimistic about the future.
No, I think you're setting a really good example for them and for other professionals. And I'm really grateful for you and for people like you who come out into this conversation from a place of nuance and not a place of backlash, but just careful examination and logic, and it's very heartfelt. And so I'm very grateful for you.
Yeah. Well, I'm really grateful for you. Because, when I heard you on Stephanie's podcast, like I'm like, that's awesome for someone to be able to, speak up and to not just go along to get along and get their degree, and, to be able to say something. I'm like, why can't I be that person? Like, why do I have to just listen to them on a podcast and admire them from afar? And then I realized, like, you could be that person, right? Like, there's nothing stopping you.
Yeah.
And it was people like you that helped me become that.
Well, I hope it continues to be contagious as more and more people decide to honor their conscience. So
I think that's a great way to put it.
Is there anywhere that you'd like to direct people if they want to read more of your, do you do any writing online, or is there some place where they can follow you?
Yeah, I started a coaching and consulting company to help parents who feel totally lost in this situation to get accurate information and support. And that's serenityparentcoaching.com.
Excellent. Well, I'll include a link in the description too. So thank you so much, Elliot. It's been great to speak with you today.
Awesome. Take care.
You too.